Redditors who work with people's bodies, hairdressers, beauticians, massage therapists. What is the most disgusting, weirdest thing you've ever seen on a customer's body? Mold in people's hair. Some people do not wash their hair very often. The problem is when they have a weave and it gets wet and never fully dries. I washed this girl's hair who hadn't shampooed it in a month. The smell was horrible. Also, taking out weaves that have been in for a while involves a very specific, bad smell. Nurse here had a 700-pound woman come in with a broken femur. She had wet the bed, and when we went to clean her up, she had this stuff encrusted all over her crotch, thighs, and folds. It looked like if you were to cut up wet cardboard into confetti-sized pieces. In addition to the typical beige fungus that grows in the folds of very large people who cannot clean themselves, nor have someone taking care of them. She smelled like a mix of sweat, rotting fish, and cat pee. It actually stung my eyes. Myself and the tech had to step away from the job for a few minutes to gather ourselves. Mortician here can confirm all of this. The beige cheesy wet parmesan stuff is beyond gross. I had a similar case. The decedent was around 700 pounds also, and had been bedridden for at least a year. I read this comment and the cat pee smell immediately came back to me, and it's been months since I worked on the person. They stunk up our cooler for weeks after they left. Worst ever. I used to work in a clinic that did IV treatments all day, so I've seen some grossness. A big problem with a lot of patients was just not bathing, usually because they were too sick weak, so you couldn't really blame them. But the body odor combined with the odor of chronic illness was hard to stomach. A sickly sweet smell and a sort of greasy waxy quality to their skin. We also had a woman who treated her illness at home by drinking colloidal silver. Her skin was blue, head to toe. We had one patient who would wet himself every single time he came in. He was old and had dementia and couldn't help it. We weren't grossed out, just felt very bad for him. His wife would always drop him off and leave and refuse to stay with him to help him. Pathologist here. I have dealt with every excretion the human body is capable of producing, and the worst was a stool sample that was literally crawling with pinworms. Worms. Goddamn worms. I had a horrific infestation of them about 20 years back. Like, you couldn't tell the color of a turd because there were so many tiny wriggling bodies covering them. I was given some deworming meds, and that seemed to work. I still found some every once in a great while, but nothing like when I shat and each butt nugget had a grotesque sweater on. I worked at my aunt's hairdressers from 1417-ish. Almost every customer was an old woman regular. Basically they came in the same time every Saturday. I was washing someone's hair and every time my hand touched it a clump would just fall out. I didn't know what to do. She was in to get a perm, but by the time she sat down that was physically impossible. She was essentially bald. Massage therapist here. So many things. 2 months ago one of my clients had a small tail. It was a couple's massage and it was pretty hard to stay mature about it and not want to get in for a closer peek. A couple of months ago I massaged a man with a cyst on his back and it ruptured all over my forearm as I steamrolled through his back. The smell was somewhere around death and rotten cheese. I have a semi-regular client who has so much hair on his body and wants such deep pressure that no matter how much oil or lotion I use it always gives me rug burn, and I have even found his hair in my mouth and on my face. The bodies are weird. Lab tech here. Haven't seen a cyst in person but I played the bacteria up for culture. One dude came in and the doc sucked up about 60 milliliters of gunk from this dude's left butt cheek. The smell was pretty bad but that was under a fume hood, so I'm guessing it would have been awful straight up. Personal trainer here. Finding out that you're training a person who has a butt plug and while they're doing front squats is, well, interesting. Please tell me it shot out. Body pisser here. The only thing I've seen so far after 3 years in my line of work was a girl with warts all over her junk. She had them literally everywhere. On her vag, on her butthole, all over her legs and butt cheeks. I just couldn't understand how she would let it get that out on control. There are things out there to help control or get rid of warts, but this girl seemed like she just didn't care. Had a friend who was a pisser. Told me he had to turn down doing work on a lady's clit because she absolutely stank as soon as she opened her legs. To the nope, not even being professional stage. Hairstylist here. I see a lot of questionable things in regards to hygiene, maintenance, and standard upkeep. The first few times I heard that you just got out of the gym and you're sweaty, I thought it was gross and kind of rude, but hey, it's just sweat. Let's wash that mop. On that note, a lot of people have dandruff and most of you have pimples on your neck. Sorry if you didn't know, and I've seen more than enough greasy hair to last me a lifetime. I'm not exactly squeamish, but there was one client who made me want to drop my shiz and never look back when I parted their hair and there was motherfricking mold growing on their scalp. This person never washed their hair and kept it in a ponytail all the time. Noppity nope. There were not enough showers in the world after seeing that. I, briefly, dated a guy with 2 feet dreadlocks. I'd seen dreadlocks before and they weren't that bad. This guy literally had pockets of blue fuzzy stuff all through them. They stank, too, like old stoner couch and moldy bread. Late to her party but, massage therapist here. I had a woman who was so heavily dosed on painkillers she was sweating them out. Sounds cool, right? Frick no. It was the most acrid, putrid smell I've ever smelled. She was so hunched over she was perpetually looking at the floor as she walked. Honestly, a 90-degree angle in her spine. Horrifying. I can't imagine the daily pain she was in. How did she even get to my office? Nobody ever came with her. So as she walks down the hall this smell follows her. It lingers. It sticks to your hair. I swear to God, she smelled as if she were decomposing. Her skin just sloughed off. I had to take a dry towel and wipe off the layers upon layers of dead skin that absorbed oils and came off in rolls in my hands. I tried using biofreeze to not only to help her muscle pain, but also to mask the smell. I was once an STNA at a nursing home. We had a new guy come in with dementia, so he had an alarm on his bed because he was a fall risk. Anyway, I had just gotten on and we were finishing report when his alarm goes off, so my partner go running to his room. We get there and find him standing up with his back towards us with nothing but a hospital gown on. We ask him to please sit down and he starts cussing us out because apparently he had stood up to pee in his urinal container. So we offer to help him. Now it was 6 AM and still pretty dark, so we didn't notice until we got closer to him that he had 2 round dark spots, one on each butt cheek. My partner and I looked closer to make sure they weren't bruises or something, and no surprise, they were eyeballs. The man had eyeballs tattooed, one on each butt cheek. We laughed pretty hard about that one but never got a clear story about why he had them because like I said, he had dementia. Haha, I once worked with a guy who had sweet and sour tattooed over his nipples. I'm always super nervous about getting my hair cut because my scalp sometimes flakes, but not like dandruff. I have only found one shampoo that stops it and I have to use it regularly. I try to keep it as clean as possible, but sometimes when my hair is long I will get 1 or 2 flakes regardless, and I'm always worried that the hairdresser will find one and be disgusted. When I was a kid, the hairdresser in my hometown told me she gave free haircuts to some of the elderly and indigenous people, and once found a spider nest in an Aboriginal man's hair. I hope she was exaggerating, but you never know. Me too. I have mild psoriasis and am extremely self-conscious about it. I use a ginger shampoo that seems to help though. I work in long-term care, so I deal with urine and feces daily. Not a problem for me. I get right in there to get the job done. The one thing that has truly grossed me out was when a new resident was showing me his nightly routine so that I could get accustomed to it. He was on the toilet and whipped out a bottle of mineral oil. He stuck his index finger in the bottle in a descriptive step-by-step manner and proceeded to stick his finger knuckle deep under his foreskin. He was digging around for a solid minute before he pulled out his nightly, cheesy surprise. How I managed to keep a straight face is beyond me. I think I discovered a name for this. Smegma mining. UHH. Esthetician here. I was once doing a facial on a woman. Her treatment included a foot massage. So I go down to her feet, hot towel them and grab my massage cream. When I realize her feet are covered in warts. Like, not one wart, but many. I asked her if there was anything she forgot to put on the consultation form. She said number. So I just grabbed some gloves and went to town. Needless to say, I didn't give her a very long massage. Seems like something to turn away a client for, honestly. It's potentially contagious. This was not a person, but I worked for a dog groomer who took on cases of severe neglect, dogs seized from puppy mills or hoarding situations. and she once shaved a dog from a puppy mill whose eye just oozed down her face when she got through the matted fur. It was pretty awful. On plus side, once she was cleaned up and treated by a veterinarian. She was adopted out and is in a happy, loving home. Doctor. Maggot infestation in chronic leg wounds. Senile husband sitting bedside in reading the newspaper unaware of the sight or smell. Patient was wrapping wounds in old newspapers mindlessly. The smell of maggots and rotting flesh is unforgettable, unmatched. Work in a hospital. Knocked on a door to see a patient. Person inside thought I said I was the doctor. I am not the doctor. Got a full frontal view of stage IV vulva cancer. Pretty gross. Lots of embarrassment on both sides. Should not have looked that up. I work in an operating room and I'm always surprised by the amount of people who don't clean their belly button. I mean, it's not that hard to do, yet we see patients with rock hard lint and debris in them. First day working at a fast-paced nail shop. Only white girl who has ever worked there. Already awkward. Massive woman gets in the pedicure chair. I let her soak for a good 15 minutes before approaching. They were horrific. But then I decided to clean under the big toenail. This crap lifted like a hinge door attached only to dry dead cuticle skin funk. I kid you not. There were mountains and valleys of who the frick knows what, like the Lamisil commercial. But the really sick part? I've worked there for 8 years now. Every day when I get home there is a mixture of my sweat and foot dust from the callous sanding machine in between my teeth. Oh, you. Caregiver hair. The blackest, most slimy, tar like crap. And I would rather clean it up a million more times than see him die. For what it's worth, I hope things improve. Hairdresser. Like the rest, I've seen horrible dandruff. A guy who had palm-sized sheets of scaly scabs all over his head, chunks of dirt, glue, and even lice. But the one that gives me the most hikes was this one chick. You know those raised, flesh-colored, tiny cauliflower-style moles some people get? Her entire scalp, all of it was covered in those things. Like all of it. It was like shampooing a furry, squishy, cauliflower Nerf ball. Dental hygienist here. I can handle mounds of tartar, terrible periodontal disease, teeth rotting out of a mouth. But to be honest, the most disgusting thing I see is when people just don't give a FCK and come to the office with a mouthful of nasty plaque. Like they haven't brushed in days and it's still soft but caked on like mashed potato. You're going to the dentist. People are going to look in your mouth. At least brush the morning of, or they just genuinely suck at brushing. To which I say, please pay attention when I am trying to teach you how to take care of your teeth. I told my hygienist I skipped my coffee in the morning because I didn't want to subject her to coffee breath. She laughed and said I could not imagine the horrors she had seen. Coffee was nothing. I've done personal care for quadriplegic people. One man was rather ill and through personal neglect had severe pressure sores and a chronic bone infection. He refused a lot of medical interventions and as the supervisor of his aides was able to insist on how his care was administered. So, although he was unable to move, he still had the right to determine what his aides were to do. This was how I learned wound care. The best way to describe his wounds is to imagine if someone sat on an explosive device. His rear end was one gaping gory opening from tailbone to the top of his legs. Several layers of skin and muscle were eroded away. His hip bones were visible. I'm talking both butt cheeks entirely, a minimum of 1 stroke to 1 inch to 2+ inches deep. The side of his hips had tunneling wounds that were as thick as a pencil and went 4 to 6 inches deep. I was shocked that someone in that condition can be alive. Aside from being wheelchair bound, if you met him you would never have known. He was alert, intelligent and seemed pretty normal. It became obvious that through his insistence and neglecting his medical needs that he was trying to kill himself in the only way he could. It was a very sad situation. I had to nope out of there because I couldn't deal with that. One day he had a diarrhea accident that leaked into his bandages. He told me just to rinse it out, bed bath, and re-bandage it. I told him no can do. There is fesses all over your sores. I basically had to refuse to do it his way, violate his patient rights and lift his paralyzed body into his shower chair to clean him up properly, without permission. At that point the ethical challenges were way too blurred and I didn't want to be a part of his suicide process. I no longer do personal care work. Lots of families treat their elderly or disabled people pretty poorly and it's heartbreaking. Even though it's against the rules, it's hard not to get attached to a person you are in such intimate contact with. My policy was always to treat every single client as I would my own mother. Being the neglectful family's vessel of poor care choices was just too dang hard. Sorry to ramble. Still kind of upset about that. Years later. This is why I think assisted suicide should be legal. If he is alert, intelligent and normal, then he should have the right to end his own life, or if physically incapable but mentally capable, have someone assist him with ending it. Highly contentious view and very murky ethically, I know. Such a sad story. The smell is the worst. Some people have really bad hygiene. I'd rather have someone with a severe skin condition than someone who has bad hygiene. Oh, not during work, but I once shaved a friend's head. His scalp was literally red, almost bleeding. The crap was more disgusting because I knew the guy. Maybe the friend had psoriasis. I've got it too, and it is really annoying. Esthetician. So much toenail fungus. But the worst is during Brazilian waxing. Smelly vag, dirty vag, cheesy vag, scabby vag, turned away the service, cummy vag. I've literally had poo on the wax strip and I gagged out loud. Damn it, late to the party again. Here goes anyway. I met a dentist last year and she told me the story of the amazing smelly child. For some odd reason the kid just stank. Not like BO or poor hygiene. There was just this horrific smell that accompanied him wherever he went. It had gotten to the point where the kid's mother knew something was up, so she'd taken him to a few different people to try and fix it. First their family doctor, who had no clue but referred them to somebody else, who also had no clue, and so on until the kid shows up at my new friend the dentist's office. I guess they thought perhaps one of the kid's teeth or gums could be the source of the stank. So, the dentist, after getting over the shock of the kid's mystery stench, checks the kid out and of course finds nothing wrong with his dental health. She does however spot something in his nose. Partly because it's not her area of expertise, and partly because frick that, she refers the kid to an ent. The ent pulled the end of a cotton tip out of the kid's nose. It had been up there so long that the kid didn't even remember when, or why, he'd put it up there. The kid had an aroma so strong you could almost freaking see it, and it was all because of a cotton tip. Crazy. TLDR. Don't leave cotton tips inside you. RN here. Infected penile implant. Patient too old and sick to have it removed. Split that sucker like a banana. I don't care about any other story here. I win. Whatever the exact opposite of an erection is, I currently have that. Not sure if this counts or not, but I used to work at a bra store that fitted people when they came in. Often they'd take their clothes off before I'd be able to explain they could keep them on, and by then most of them would just keep them off anyway. One woman, who was morbidly obese, lifted her boobs so I could measure her, and the smell that came out, if it was like rotting meat and cheese. I don't think the poor woman cleaned in between her all very often. That was a 3-hour shift and it's easily felt like the longest shift I've ever done. The smell still haunts me to this day. Pressure ulcers when left for too long will leave large gaping holes in the place of contact. I was helping the nurse with one of my residents so she could repack one of the wounds, and I swear it was like a magic trick. At least 5 feet of bloody, pus-drenched gauze was pulled out of this woman's back. Nasty stuff. After reading some of these, I guess I feel lucky. Tattoo artist here. Lady comes in and wants her foot tattooed. Infinity symbol. Why are these popular with kids' names? Okay, whatever. Cool. Go draw it up. She loves it. Get set up to do it. She takes off her sock to reveal what can't really be put into effective enough words, but I would say is best described as Smorg's claw marinated in a stagnant sewer pit for a decade. Like, this lady's foot had 3-4-inch sharp yellowed talons protruding from her blackened flesh. White woman. Just severe amount of non-washing. And it all reeked as if the devil himself got a bad case of Montezuma's revenge directly onto this woman's claw. I've never been more thankful for that nurse revealing her peppermint oil secret. I slathered my mustache with that crap and busted out my alcohol wipes and scrubbed literal chunks of grime off this beastly appendage. Whipped out a world record speed tattoo and sent her on her way. My co-workers and I pray every day that we never see her again. Former massage practitioner here. My very first client during mock clinic in school was missing half of her torso. Just a giant gaping hole thing on her right side, which made the rest disproportionate. Smelled bad too. She enjoyed the massage as much as I enjoyed ending it. I posted this on an earlier thread as well. It's raunchy. Enjoy. When I first started doing massage about 15 years ago, I was working in a fancy spa type setting. I was doing a couples massage along with my coworker. I was massaging the lady and she was massaging the gentleman. Well, unfortunately the gentleman had a Sacagawea coin-sized pus-filled blister on his back that popped during the massage. Every time my coworker made a pass down his back, the blister would glurp a little more of its heck juice onto his back. Our clients were both face down, so we were making the most wretched faces at each other to express our disgust as my coworker did her best to avoid touching the yellow mess. Over the 10 years I did massage therapy, I saw some interesting things and met some characters, but I will never forget that blister. In retrospect, I don't know why we didn't say something about it to him. I guess we figured he must have known about it because it was huge. I'm a barber and I think I speak for most when I say it takes a certain acceptance of the human condition to do the job. By board regulation you can't work on person with open or oozing sores, so I have definitely turned some services away for that reason, but even if someone is filthy I'll glove up, put them in the sink and clean them up, and I am genuinely never disgusted by their biology. The only thing that ever truly disgusted me was a person's lack of manners or the ignorant things they said in the chair while their guard was down. I'm at work and have free time, so as a guy that worked for a long time with shops full of pretty stylists, if anyone is curious about behind the scenes conversation about clients or the real reactions that come out after you leave, just ask and I'll fill you in. I do hair and nails at an upscale salon and there's two people I remember just because they were gross. First one was a haircut client. I washed her hair and started cutting it. I noticed a weird mole on top of her head, but I wasn't going to point it out or ask about it because I figured it was something she may be insecure about. It was weird looking because the skin around it was all pink and the mole was about a centimeter in diameter and it was a whitish color. So after I'm done with the cut I start the blow dry. I get to the top section and the freaking mole is gone. There's a pink spot on her head and no mole. I don't know where it went, but I half-assed the rest of that crap and sent her on her way before I puked. The second was a pedicure client. She was pretty old. I had her soak her feet and then I get started. The first foot I pulled out, she had a big blister on the outside of her baby toe. I asked if it was painful and she said no, it was old and healed up. She said she went on a wine tasting and wore new shoes and got terrible blisters on both feet and was waiting for them to heal before she got a pedicure. The other foot comes out and OMG, her entire pinky toe is a freaking old nasty flap of dead blister skin. At this point it's like flapping around because it's been soaking for 20 minutes. So I take my foot file and run it over the nasty flap of soggy dead skin and the entire outer layer of skin off her baby toe flops off onto the floor. I gagged. Seriously B, you couldn't freaking peel that crap off yourself before you came in? Freaking disgusting. I am a dreadlock artist. Mold, you would not believe how many people don't realize that keeping your locks dry is pertinent to their health. It's tragic, because there's only so much that can be done to try and get it all out. A few clients' dreads have had to be cut because the mold had completely destroyed the hair and was literally just eating it away. Usually I can get it all out, but sometimes I can only salvage part of their dreads that are infected. Cut above the mold and get as much out as I possibly can, and it is then up to the client to continue with vinegar soaks and using a hair dryer every time to ensure they are completely dry. That's generally what causes some dreads to smell. Trust me, most of us are really good about washing our hair. You get sebum buildup on your scalp that can lead to painful sores if you don't keep that crap clean. It's the moisture, and usually because they've put wax in their hair which traps a ton of moisture, thus causing mold. Another point, never fricking use wax. Stop that crap. Frick. Stop it. It's bad, okay? You want moldy dreads, go ahead and use wax, but you're gonna end up with some nasty smelling mold infested hair. A nail. It was a father of one of my students. I'm a teacher. I work with brains, so I'm totally qualified for this. I just grabbed his arm as he walking past the classroom he was supposed to be in, since parent herdering with words gets old real fast. Instantly feel something real strange under his shirt and obvious, pull my arm away. He looks at me real strange and goes hug. I tell I felt something weird and excuse myself. If you can do a vaginal piercing, a bicep feels perfectly normal. He then pulls up his shirt and shows the head of a nail sticking out of his upper arm and tells me someone shot him with a nail gun 20 years earlier and he never bothered to get the nail out because it seemed pretty stuck. Gonna have to call bulls on this one. I'm not a doctor, but I am pretty sure you can't keep a nail inside you for 20 years and not have the wound get infected. Wife is a paramedic. She found a Valentine's card under a woman's very large boob once. Oh, and a grilled cheese sandwich under a fold. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.